respiratory tract infections, a daunting viral illness that all reptile keepers fear. Although, what is a respiratory tract infection, and how are respiratory tract infections caused? First, before I continue on with this video, I want to make a quick disclaimer that this video is not a substitute to veterinary advice or proper veterinary diagnosis of a respiratory tract infection. Although we'll be discussing the clinical signs or symptoms of a respiratory tract infection, so if your reptile has one of these symptoms, please do bring your reptile to see an exotic veterinarian. In reptiles, respiratory tract infections are caused by a bacterial infection in the lungs. A respiratory tract infection is generally related to improper environmental conditions, example, being kept too cold, too wet, prolonged stress due to enclosure being kept at a single temperature rather than species required, too irradiant, prolonged stress, and many more. If the reptile is not otherwise being cared for properly, again for example dirty closure, inadequate feedings, etc., this can exacerbate the condition, making it more severe and prolonged recovery. Knowledge and understanding of the unique reptilian respiratory anatomy is mandatory for successfully knowing how to spot and treat a respiratory tract infection. Respiratory tract infections may be the prime disease or may have developed secondary to underlying disease processes also requiring treatment. The anatomy of the reptilian respiratory system is unique and differs considerably from mammalian and avian species. Reptiles lack a functional diaphragm, and therefore the force to move air during inspiration and expiration comes from movement of the respiratory muscles such as the intercostal, pectoral, and abdominal musculature, causing changes in intrapulmonary pressure. A structure separating the thoracic and abdominal cavities have been described in crocodilians and several lizards and tortoise species. However, this fascia-like structure does not aid in the movement of gas between the lungs and the environment. Differences in the structure and function of the respiratory system are present between orders of reptiles as well as between the species from the same order. Anatomic differences of the reptilian respiratory system have been recognized for many years, but there is inconsistency in the terminology used for description of various pulmonary structures. As in mammals and avian species, the reptile respiratory tract is divided into an upper and a lower part. In snakes, air passes through the external nares, nasal sinus, and the internal nares, and enters the glottis from the buccal cavity. The glottis is located rostrally within the oral cavity, allowing the movement of air while swallowing the large prey items. The trachea consists of incomplete carcinogenic rings and bifurcates into short bronchi at the level of the heart. Some snake species have a tracheal lung consisting of vascularized respiratory tissue. The lungs are elongated sac-like structures, with the left lung being vesicle in most species, except in boiled snakes. Depending on the species and environment, the snake is adapted to the right lung lined with respiratory epithelium joins with a caudal vascular sacculus lung lined with the non-respiratory epithelium. The lungs of aquatic snakes are lined with more respiratory epithelium than terrestrial species for a more efficient gas exchange during prolonged periods of apnea. In carnivorous lizards, the glottis is located rostrally, while in herbivorous species is located more caudally at the base of a fleshy tongue. Like snakes, lizards have incomplete tracheal rings and tracheal bifurcates approximately at the base of the heart. The lungs of most lizard species are sac-like, single-chambered structures and may extend caudally into the avascular air sac, which in some species occupies a major portion of the coelomic cavity. Iguanas have a short intrapulmonary bronchus and possess multi-chambered lungs consisting of a small anterior chamber and a large posterior chamber. Agam lizards lack an intrapulmonary bronchus. Owners often fail to recognize the early and mild signs of a respiratory tract infection in reptiles, because they may be subtle or slow to develop. Consequently, many reptiles are presented in advanced stages of respiratory disease, and a variety of clinical signs, including those associated with other organ systems than the respiratory tract, may be present. Although respiratory disease may be present at the primary symptom, in many cases, especially chronically ill and septic reptiles, multiple organ systems may be affected. Prior to treatment, it is essential to determine if the animal has an upper and or lower respiratory tract infection. In snakes, serious to prurient nasal discharge, wheezing, accumulation of respiratory secretions within the oral cavity, and osmosis are common clinical signs. In severe cases, increased respiratory effects and dyspnea are also present, due to lack of a functioning diaphragm. Snakes lack the mechanics to epithelial respiratory secretions and debris from trachea. Thus, the presence of fluid within the trachea results in an narrowed tracheal lumen. Typically, in these cases, presenting clinical signs are open mouth breathing and extension of the front half of the body to facilitate movement of air through the trachea. In lizards, clinical signs include nasal and ocular discharge, accompanied by rhinitis, conjunctivitis, and stomitis. Bacterial abscesses within the oral cavity may cause displacement of the glottis and severe dyspnea. In chronically infected lizards, the periorbital abscesses are frequently observed. Frequent sneezing with serious to mucoid discharge may also be present. In severe cases of pneumonia, increased respiratory efforts are often present. When you notice signs of a respiratory tract infection, not only must you evaluate and correct the environmental problems, but you must take the reptile to see an exotic vet to be evaluated for symptomatic antibiotic therapy and possibly fluid and nutritional support. If the reptile does not respond to environmental correction and the antibiotic therapy, a culture and sensitivity should be done to determine exactly what the organisms is and the best antibiotic to combat it. The sample is easily taken by the vet in the form of a choanal swab or in more difficult cases a lung washing. Next I'm going to talk about the treatment of a respiratory tract infection. I'm not a vet, and even if I was, like as I stated in my disclaimer, this video is not a substitute to veterinary advice or a proper diagnosis of a respiratory tract infection. The information in treating a respiratory tract infection requires two things: an immediate evaluation of day and night temperatures in the reptile's enclosure, where additional heat sources added or broken functioning equipment are placed, and attention of an exotic vet who will evaluate the reptile for symptomatic antibiotics and fluid replacement. In addition, if the reptile has cage mates or lives in a room where he or she is in line of sight of other reptiles or household pets, an overall psychological evaluation needs to be made. Reptiles with respiratory tract infections should be kept in draft-free but well-ventilated enclosures maintained at the species daytime temperature gradient, both during the day and at night. For reptiles who require a hotter basking area, the basking area temperatures do not need to be provided at night, but the higher overall gradient does. This not only enables the reptile's own immune system to function better, but increases the efficiency of the antibiotics. To conclude, if you see the clinical signs of a respiratory tract infection from your reptile, and if it's not related to being handled too soon or after eating or drinking, get your reptile to see an exotic vet as soon as possible. Big or small delays can and will result in a weaker reptile, and depending on why the respiratory tract infection occurred, it may prolong recovery and stress. That's it for this video, so I hope you learned a bit about respiratory tract infections, or that I have furthered your knowledge on respiratory tract infections in reptiles. I really do hope you enjoyed the video too. Thank you for watching, and don't forget to like the video and subscribe. See you in the next video. Bye guys.